Today's lecture is going to be covering the eyes and the ears. First, we're going to start with the eyes. I have posted this video link to Blackboard for you to watch. First, we're going to talk about the characteristics of aging of the eye, which is decreased elasticity of the lens. They have difficult peripheral vision, decreased pupil size, difficult night vision, sensitivity to glare and distorted depth perception. When we are talking about data collection, you're going to have subjective and objective data. The subjective is going to be their health history, things that you're asking them, and their symptoms, because you cannot see some of their visual or auditory symptoms. An objective data can be the Snellen test, an E-chart. An E-chart are used for those who can't read English, and the Rosenbaum is elevate your near vision. Normal vision is considered 20/20. Low vision is considered 20/70 and 20/200, and legal blindness is considered 200/20 or less. What they're talking about, these numbers are, they're in feet. So if you have normal vision, you can see a normal 20 feet in a normal range. When they're talking about low vision, is they see letters at 20 feet that normal vision can see at 70 feet. So that's what those 20 and 70, 20 and 200, that's what they're talking about with those. Some basic therapeutic measures are going to be regular eye examinations, eye hygiene, nutrition for the eye health, eye safety and prevention, eye irrigation if needed. They can also provide guide dogs. We're going to make sure they know how to administer their medication and the correct use of eye patching if needed. Here is some basic vocabulary for the eye. Here are some more refractive errors, their term with the definition. Here are some examples of visual field abnormalities. So number A, or letter A, that is a normal vision. B, that is what they consider seeing floaters. C is what they considered blurred vision. D is with macular degeneration, which we will talk about. They're losing their central vision. And then glaucoma is E, and they're losing their peripheral vision. So blindness is legally considered blind if they can only see 20 feet instead of 200 feet. So what that's saying is someone can see something at 20 feet where a normal vision can see it at 200 feet away. You could have partial or complete. Partial is cloudy vision, which is inability to see shapes, shadows, so they can see shadows only, sorry. Poor night vision or tunnel vision, whereas complete, if they see nothing, it is completely dark. First, we're going to talk about diabetic retinopathy. This is a vascular changes in the retinal blood vessels. So too much sugar in your blood can lead to blockage of the tiny blood vessels that nourish the retina, which cuts off your blood supply. The eye can make new blood vessels, but they leak. So your signs and symptoms here are you're going to see, they're going to complain of floaters, blurred vision, fluctuating vision, impaired color, dark or empty areas in their vision, which goes back to those floaters. And it could lead to blindness. This is usually seen in both eyes. Retinal detachment is a whole tear or separation of the retina from the pigmented epithelium. Signs and symptoms are going to be a sudden change in vision. You're going to have flashing lights or floaters. Some of them link this to cobwebs. Some of them say that it's as if they're looking through a veil, which goes back to those floaters and cobwebs as well. Some say it's as if a curtain is being pulled over their vision. This is usually painless. Some therapeutic interventions would be a laser reattachment, and this burns, and when it burns, it produces exudate that forms, and it results in the adhesion of the retina back. Cryosurgery is freezing, which is a super cooled probe that helps reattach. Or they could have a scleral buckling, which is a surgical procedure in which a piece of silicone or sponge is sewn into the sclera at the site of the retinal tear to push the sclera toward the retinal tear. The buckle holds the retina against the sclera until scarring seals the tear. Things we're going to watch for with any kind of surgery is you're going to watch, make sure they apply the eye patch, which helps relieve the strain of the eye. Make sure they have no heavy lifting. They're not straining to go to the bathroom or no vigorous activity. Glaucoma is a group of eye disorders in which there is an increase in the intraocular pressure. This is not the same as your intracranial pressure, so this is just pressure in the eye. The normal pressure is between 10 and 21. This usually happens bilaterally, and it is just an inadequate drainage of the fluid. These patients are going to be on lifelong treatment, and so any pressure that is greater than 22 is going to be considered an increased pressure. We're going to talk about two different types. The first one we're going to talk about is acute angle closure, which is a medical emergency, and it can result to blindness if it's not treated fast. Signs and symptoms are usually a very sudden onset with severe eye pain and headaches, blurred vision, and the cornea becomes cloudy. There can be rainbows around lights. They can have eye redness, photophobia, and the eyes can become hard, and the patient can complain of nausea and vomiting. The next one is called the primary open angle. This is the most common, and this is a degenerate of the drainage system blocks. So the drainage system is being blocked gradually. So this is a gradual and painless glaucoma. They can have mild eye aching. They will have halos around lights, reduced peripheral vision, frequent visual changes. And so what they're saying there is they're going to feel like they have to have their eyeglasses changed a lot just because they don't have that frequent visual acuity. They could be asymptomatic for a while. But again, the biggest thing with glaucoma is you will start to notice that they are losing their peripheral vision. Here are some common medications. The Hesse book also talks about different medications on page 129. The biggest thing to do, like the importance with medication, is they need to avoid medications that dilate the vessels, as this can cause blindness because it's allowing more fluids to come in. We also need to talk to them about the importance of medication compliance to make sure that they're keeping these medications are going to keep the pressure down. So if they stop these medications, it's going to increase that pressure, which can lead to blindness. With the nursing plan, we want to avoid nonverbal communication, especially, remember, they're losing their peripheral vision, so we don't know exactly what all they're seeing. Again, we want to talk about the importance of their eye drops. We got to teach them how to use eye drops and avoid activities that increased intraocular pressure. So how to use eye drops: we're going to make sure we are washing our hands. The head should be slightly back. We're going to place it in the lower lid, and they should leave their eyes closed for 3 to 5 minutes. And we want to make sure that when we're giving multiple eye drops, we do not give them back to back. We need to wait before we give the next eye drop. Activities to avoid would be emotional upset, coughing, sneezing. We want to make sure we are not utilizing constrictive clothing. We want to prevent them from straining. Cataracts is a condition that causes opacity of the eye lens, which is the lacking of transparency. Early signs are blurred vision, decreased color vision, and seeing halo around lights. Some late signs are diplopia, blindness, and clouded pupils. They can have a milky white appearance, and a light cannot be filtered and the vision becomes blurred. Cataracts can be, some therapeutic interventions would be the surgical removal of the lens or the lens implant. Nursing care, we want to make sure that they're not rubbing their eyes or putting pressure on them. They're going to have to wear glasses or some kind of eye shades for the first 24 hours for sure, and then continued for a week when they're outside or in any kind of bright light. Eye shields should be used during sleeping. There should be no lifting over 5 pounds. Make sure we're utilizing stool softeners if needed to make sure they're not straining. We want to avoid laying on the operative side. And we want to make sure they do not immerse their eye in water. They could be on eye drops for up to a week to prevent an infection. If they use glasses to replace instead of an implant, everything will have a curve, so they will have depth perception issues. Macular degeneration is the breakdown of or the damage to the macula, as you can see right here in the picture. There are two different types: wet, which is leaking fluids and blood into the macula, or dry, which is the thinning of the macula by forming small yellow deposits known as drusen under the macula, which causes the thinning. Dry usually occurs in 85 to 90%, and this usually affects both eyes. This is a slow, progressive loss of your central vision. So remember, the macular degeneration is your central vision. They have to do a daily vision screening, the Amsler grid, which is on the next screen. Here is an example of the grid in which someone with normal vision would see, and then someone with macular degeneration would see. The main difference between the two, macular degeneration, is the wet is sudden and worsens rapidly, while the dry is a gradual and without pain. Different types of eye emergencies would be your foreign bodies, burns, abrasions, lacerations, or penetrating wounds. With foreign objects, we can irrigate with normal saline. Chemicals are going to depend on what kind of chemical it was as to what you're going to irrigate with. And we're going to make sure we're remembering that if there's a penetrating object, we never remove the object. We want to stabilize the object if possible, but we are never to remove the object. So depending on the eye trauma, there are different ways of treatment. Biggest thing for the nursing plan is we want to make sure we're not putting any extra pressure on the eye. Making sure we cover the eye with a dry sterile patch if we need to. Keep the head elevated 45 degrees. And we're going to make sure that they're not trying to watch TV or reading for a while, at least for 3 to 5 days, to make sure that they're not straining their eyes. Next, we're going to start talking about the ear. Here is a video for the anatomy of the ear for y'all to watch if you need a touch-up on your ear anatomy. Presbycusis is a progressive hearing loss or a loss of high-frequency sounds. Conductive hearing loss is in the interference with the sound conduction to the external auditory canal, eardrum, or middle ear, where the sensory neural involves the hair cells or nerve endings. There are some different tests that can be done for auditory imbalance. A whisper voice test is when the nurse stands 1 to 2 feet away from the patient and whispers a word to the patient, and the patient has to repeat it. The ear that is not being tested needs to be covered, and you need to make sure we're doing both ears. The Riney test utilizes a tuning fork, and you strike the tuning fork and place it on the patient's mastoid process, and the patient is to tell you when they can no longer hear. And then you do the same thing, but place the tuning fork 2 inches in front of the ear. The one in front of the ear should be heard longer. The Weber test uses a tuning fork as well, and it is placed in the center of the patient's forehead. Ask the patient if they hear better in the left ear or the right ear, or if both ears are the same. If conductive, the sound is heard better in the affected ear. If they have the sensory neural, sound will be better heard in the good ear, but they are supposed to be the same. Balance testing can be done by Romberg's test, and you're going to have them stand with their feet together, with their eyes open and with their eyes closed to see if they can balance. Therapeutic interventions would be talking about utilizing hearing aids or talking about cochlear implants. Cochlear implants are used if middle ear implants for those with the sensory neural hearing loss. For external ear problems, you can have impacted cerumen, which is normally can be usually corrected with ear self-cleaning, usually seen in older adults, can lead to hearing loss and feeling of fullness. They can also have masses or trauma that can impact the external ear. Therapeutic interventions would be your antibiotics, irrigants, incision and draining if needed, analgesics. The biggest thing we need to remember with the ear is how to pull the ear back to straighten the canal. So for an adult, we're going to pull the ear up and back. For a child, we're going to pull the ear back and down. So make sure we are utilizing the correct way to straighten that canal when we're doing any kind of antibiotics or irrigations. Otis media is an acute inflammation or infection of the middle ear. You can have fever, earache, feeling of fullness, diminished hearing, tenderness behind the ear indicates mastoiditis. They're going to be provided antibiotics. And the myringotomy is an incisional opening of the tympanic membrane, which facilitates drainage and eases pain. The drainage will be bloody and then purulent, and we want to provide loose packing of the ear. With the middle ear infection, the tympanic membrane is going to look red and bulging. Otosclerosis is the hardening of the ear, and what's happening here is new bone develops along the stapes, and the stapes is the third bone in the inner ear. Usually causes conductive hearing loss, but it can be a mixed. This is more common in women than men, and this is recognized by progressive hearing loss in both ears. Tinnitus, especially noticeable at night. And with this, the tympanic membrane is going to appear pinkish orange. There is no cure. However, they can provide hearing aids to help with the hearing loss. And a stapectomy is a part or the removal of all the stapes, and it can be replaced with a prosthesis, which is the treatment of choice. With this, we're going to make sure that the operative ear is upward when they're lying. We're going to provide antiemetics and promote safety. We need to make sure that these patients are not coughing, sneezing, blowing their nose, vomiting, lifting heavy objects, shower, and they have a time limit as to when they can fly with that higher elevation popping of the ears. Some different middle ear trauma would be the tympanic membrane perforation, which is very painful. And usually when the pain goes away, that's when the drainage starts. This is most commonly seen with the use of cotton swabs, with the eardrum being busted. This usually heals on its own, but if not, a patch can be used, and this helps the membrane grow back together. This also can be caused by an infection, trauma, falling, motor vehicle accidents, or sports injuries. Another common trauma is the middle ear ossicle fracture, and depending on how bad it is, it's going to depend on what the management would be, if it just needs to heal by itself or if there needs to be a surgery. The inner ear, the first one we're going to talk about is labyrinthitis, which is the inflammation or infection of the inner ear. With this, they're going to have vertigo, they're going to need antibiotics, sedation, and bed rest. And another inner ear is a neoplastic disorders, which is your acoustic neuroma or vestibular schwannoma, which meaning it is a benign Schwann cell tumor. This is a rare tumor. It is seen in 1 in 100,000 people, and it is a tumor of the 8th cranial nerve. This usually leads to hearing loss because when they go in to remove the 8th cranial nerve, they lose the hearing. Meniere's disease is a balance disorder due to a fluid disturbance. The symptoms can last a few minutes to weeks. There's a triad of symptoms, which is vertigo, hearing loss, and tinnitus. Bouts can be 2 to 3 times a year, just depending on the patient. Acute treatment is we're just trying to help control the symptoms the best we can. Prophylactic treatments are going to do salt restrictions, administer diuretics, antihistamines, vasodilators. We're going to try to teach them to avoid alcohol, caffeine, and tobacco.